Okay, the next item of business is a debate on motion 16252 in the name of Jackie Baillie on supporting Scotland's health and social care workforce. I would invite members wishing to participate to press the request to speak buttons now or as soon as possible. And I call on Jackie Baillie to speak to and move the motion around 12 minutes. Ms Baillie.
Thank you, Presiding Officer. Let me begin on a note of consensus. The staff of NHS Scotland and those working in social care do an incredible job. They are the backbone of the NHS and the backbone of social care. Without them, the services would collapse. So they deserve our heartfelt thanks. But they are firefighting in a broken system, and they are telling us that things cannot go on like this. Staff are leaving the NHS and social care in their droves, and far too many are being signed off with exhaustion and poor mental health. They're burnt out because our NHS and social care system is in a state of crisis, and responsibility for this lies squarely with the SNP government. Right now, over 863,000 Scots are stuck on an NHS waiting list, over 100,000 of them for over a year. In Scotland, more than 7,000 patients have waited over 2 years for surgery. In contrast, in England, with a population more than 10 times our size, only 151 people are waiting more than 2 years. Cancer patients are let down as treatment targets are not met. Thousands of children are stuck on CAM's waiting list as countless others are turned away. Health inequalities are widening and life expectancy is declining. 2,000 Scots are currently stuck in hospital, medically cleared to leave, but unable to do so. So let me say very politely to the First Minister, who was very animated with me last week, that across a whole host of measures, things are getting worse, not better. To deny the pressures facing the NHS in Scotland is frankly delusional. And I am tired of the Cabinet Secretary telling me that things are actually okay. This is causing moral injury to the staff, it compromises patient safety, and it results in worse outcomes. But don't just take my word for it. One nurse in the RCN's damning report into corridor care, which is now the normal, said, "I am now in the process of leaving the NHS. It is fraying at the seams and has left me with mental health problems and trauma." The crisis cannot be blamed on winter flu cases or COVID-19 because the NHS was sailing into troubled waters long before 2020. And the SNP have been in charge for all of that time. For 18 years, they have failed time and time again to protect the health service or to plan for its future. And let me be honest, attempts at workforce planning have been woeful. And the SNP have to own the consequences of that, because the evidence is there for all to see. Audit Scotland report that the target of 800 more GPs is unlikely to be met. The BMA tell us that just to stand still and meet current demand, they need an extra 1,000 GPs. They also point out that GP numbers, despite that promise, are actually declining, not increasing. And at the same time, patient numbers are rising and GPs simply cannot care for more people on current capacity. It's little wonder that people vote with their feet and head to out of hours or A&E because they can't get appointments. Last night, I was told about GPs who are unemployed in the Lothians. Yes, let me repeat that. Unemployed. At least one is working for Uber. Others go to Australia to work 1 month on and 1 month off. At a time we are so short of GPs and patient demand is increasing, what is the government thinking? This is such a shocking waste of talent that could be deployed in our NHS. I'll give way briefly.
Hamilton, briefly.
I'm grateful to Jackie Baillie for taking my intervention. Does she recognise that problem in Lothian is particularly bad among GP locums?
Jackie Baillie.
I do indeed, and that was the situation I was describing. So he and I are of one mind on this. The BMA say that there are over 1,000 consultant vacancies, enough to staff 2 large hospitals, but the Scottish Government only report 397. Yet more understaffing and that's not tackling waiting lists, is it? Since 2019, the NHS has spent over £900 million on private agency nurses and locum consultants in an attempt to desperately plug gaps, sticking plaster instead of real solutions, and at a cost greater than employing the staff directly in the NHS. Now, we know that there are not enough nurses in the NHS to meet demand and provide safe care. High vacancy levels persist, with the latest data showing that there were 2,380 nursing and midwifery jobs lying vacant. The Royal College of Paediatrics and Child Health produced a report last year titled Worried and Waiting. Recommendations included a number on critical workforce pressures, including a call for a specific workplace strategy for the child and healthcare workforce. They have highlighted rota gaps, which is not good for patient safety. But has any of this been addressed? Macmillan warned about a cancer care gap as the numbers of people with cancer rise, but this is not matched by an increase in the workforce. Marie Curie tell us about the lack of palliative care staff, or even the lack of training for generalist staff about end-of-life care. And then there is mental health. SAMH report a significant increase in demand for services for both adults and children. We know this from our own constituency casework. And the SNP promised access to a mental health worker for every GP practice. 1,000 new people were to be recruited. But then they cut the budget in 2023. Another pledge jettisoned by the SNP. Now, we all know that the SNP received record funding from the UK Labour government in this latest budget. Yet they have chosen not to invest in a proper workforce plan. To be clear, that is a political choice that this government has made. The SNP have the money, they have the power, and they have simply chosen not to use it. They know that staff are crying out for support, yet they're being ignored, so much so that the First Minister couldn't be bothered to invite Unison to his health meeting last week. He's happy to use health and social care staff as his human shield, but not happy to sit down with them to understand the challenges they face. And let me mention the Cabinet Secretary, the very person who is supposed to be responsible for health and social care at the top table of government, distracted by Limogate and sidelined by his boss. But to be frank, I am not sure the First Minister is any more competent. Remember, it was John Swinney as Finance Secretary that cut £70 million from social care while people were stuck in hospital, unable to get a care package. Remember, it was John Swinney as Finance Secretary who cut £65 million from primary care services, making it more difficult for people to get a GP appointment. And remember, when he was Deputy First Minister, he was at the heart of a government responsible for overseeing delivery when delayed discharge soared, when A&E waits went up, and when the 62-day cancer target failed to be met every year since 2012. I genuinely worry about what he will do next. Because instead of taking any responsibility, the SNP hide behind staff, repelling every criticism as somehow the opposition are talking down staff and suggesting that they are incapable. For the record, Presiding Officer, it's not NHS staff or social care staff that are incapable, it is this SNP government. Let me give you a few examples. The Scottish Government spends around £60,000 per student nurse to train at a Scottish university when taking into account study and bursary costs. Money well spent for such an important role. Yet last year, almost 100 graduate paediatric and adult nurses were told there were no jobs for them despite staff shortages. Budget cuts meant vacancy freezes. In fact, last year, the SNP quietly cut 1,500 nursing and midwifery jobs from the establishment records, before any budget cuts had even begun. Posts simply wiped out overnight. Since then, I've been contacted by paramedic graduates who have experienced the same problem, and by junior doctors who've been told that they'll need to undertake their specialty training in Northern Ireland as there's nothing happening in Scotland. I have heard from graduate pharmacists like Abby, who've been told that due to a lack of funding, there will be no foundational training year for them in Scotland, so that they'll have to go to England if they want to continue. The Scottish Government is paying to train health and care staff for the benefit of every NHS in the UK, except for NHS Scotland. If that isn't incompetence, I don't know what is. The current pressures in our hospitals are in part due to this government's failure to fix the problems in social care. Over 9,000 Scots are waiting on care assessments or care packages. We know there's a chronic shortage of support available because we don't have the staff, and we don't have the staff because they are not treated with the respect they deserve, and so they head for the exit door. Is it any wonder that many of them are going to work in retail, where they're often paid more and have less stress? Labour has consistently argued for £15 an hour year after year, with finance ministers Kate Forbes and John Swinney both deaf to the plight of social care staff. What happened to the missing £50 million for Fair Work to improve terms and conditions for social care staff? Cancelled by ministers at the 11th hour. That tells you all you need to know about how much the SNP values social care. Scotland cannot keep paying the price of the SNP's financial mismanagement and waste. Their recklessness is a betrayal of the NHS and social care staff that have gone above and beyond to keep services going and keep patients safe. After nearly 18 years of failure and decline from the SNP, it is time to change the team. Scottish Labour will ensure that our NHS and social care sector have a 10-year workforce plan that creates enough medical and nursing training places, that values nurses, doctors and all NHS staff, and meets the needs of future generations of patients. We will deliver faster access to GPs, will tackle long waits for treatment once and for all by taking full advantage of our untapped potential. Presiding Officer, Scottish Labour is and always has been the party that is willing to stand up for workers and protect our NHS and invest in social care. Scotland's NHS needs a new direction, and Scottish Labour is ready to deliver it. Thank you.
Can you move the...
And I move the motion in my name.
Thank you, Ms Bailey. I now call on Neil Gray to speak to and move Amendment 16252.1. Cabinet Secretary, around 9 minutes. Please.
Thank you, Presiding Officer. I move the amendment in my name. I welcome this debate, which is very timely in light of the speech given by the First Minister on Monday on protecting and renewing our health and social care system. A plan of substance, a plan that is to deliver. In his remarks, the First Minister acknowledged the central role these most cherished of public services play in all of our lives. It's why we as a government attach so much importance supporting our health and social care system and those who work within it. And I agree with Jackie Bailey that staff are the backbone of our health and social care system. Without their skills, their expertise, their endeavours, the system simply could not operate. And I have been privileged to witness firsthand their dedication and professionalism in my role as Health Secretary. We also know that services are struggling. People are waiting too long for treatment, and there have been periods of real crisis in recent weeks linked to the exceptionally high flu prevalence that we have seen. And I want to put on record my thanks and admiration for the resilience of staff in the face of these extreme pressures. We are all grateful to them for their efforts. We must also acknowledge that the sustained and significant pressure that the system has faced and continues to face places real pressure on staff. Change clearly is needed. And while a shift in demographics and changes in the burden of disease means reform in our health and social care services would always have been necessary, the pandemic has undoubtedly impacted on the scale and pace of change required. Our efforts to recover certainly have not been helped by decisions taken at Westminster. A decade and a half of austerity, coupled with the shock of inflation, has meant that our already stretched resources have been able to deliver less. Brexit continues to impact staffing in our social care sector, and coupled with the UK Labour government's decision to continue the Tories' cruel policy of preventing care workers from bringing dependents to the UK, will have a deep and lasting consequence. The Home Office statistics show a staggering 82% drop in health and care worker visa applications between April and December 24 when compared to the same 9 months in 2023. More recently, decisions made by I'll make some progress and then come back. More recently, decisions made by Jackie Bailey's colleagues in the UK Government to increase employer national insurance contributions are expected to cost more than £191 million to the NHS alone, with these costs rising to around £315 million when we take account of NHS contractors, including GPs, dentists, optometrists, pharmacists, as well as the adult social care workforce. It is vital, therefore, that the UK Government fully funds the increase to avoid Scotland being punished for investing in key public services. I give way to Claire Adamson.
Thank you. If I'd waited, Cabinet Secretary, you almost answered my question. But does he share my concern that the national insurance rise has been reported by the BMA as being an existential threat to general practice?
Cabinet Secretary.
Yes, I do, and I could list the names of those that signed the letter from the First Minister and the President of COSLA. The wealth of experience and dedicated commitment that comes from that signed letter from Civic Scotland underlines the need across health, across social care, across all elements of public service to see this resolved at source. But looking ahead, I believe that the draft budget provides strong foundations for the improvements we all want and need to see delivered, including our commitment to providing funding to enable social care workers to continue to be paid at least the real living wage. The budget represents a package of investment to reduce the immediate pressures across the health service, to speed up the rate at which individuals can be treated by delivering an additional 150,000 planned care procedures over the coming year, that shift the balance of care from acute services to the community by expanding hospital at home, opening more frailty units, ensuring that a greater proportion of NHS funding goes to primary and community care, using innovation, digital and technological, to improve access to care. Our NHS workforce is central to delivering all of these improvements, and we simply cannot afford to underestimate the role that social care staff will play in enabling and realising these ambitions. I give way.
Brian Whittle.
Very grateful for the Cabinet Secretary to give way, and he knows my interest in the technology. But during COVID, that demonstrated to us the impact that technology can have on healthcare and the speed at which it can be deployed. Why has that been lost since COVID, and why all we have now is the option of an app that is already being deployed in the rest of the United Kingdom?
I don't believe that is the case. I believe that there is progress being made through the likes of Anya. They were able to see on Monday the incredible innovation that's coming through the National Robotarium, for instance. And I'm looking forward to the opportunity for a rescheduled meeting with Mr Whittle to discuss some of these areas. We know that the improvements to social care will strengthen our NHS and our communities, and we remain determined to invest and deliver the vital changes needed. But it is very easy just to point to the problems and challenges, as much as I recognise them, Presiding Officer, but we are focused on resolving them. We will never shy away. I'll need to make some progress. We will never shy away from the challenges facing our NHS and social care services. We will act quickly to deliver much-needed change and are starting from strong foundations. This Government has overseen a 26.6% increase in NHS staffing, including 12 consecutive years of workforce growth, which contradicts the false assertion made in Labour's motion regarding graduates. We have planned for and driven— I'll make some progress and then come back to Ms Bailey. We have planned for and driven workforce growth through investment in training our workforce of the future, with increased graduate-funded places for health and care professions. Going forward, our workforce planning will continue to evolve to account for the shift in the shape and size of the workforce required. Part of this will be the consideration of the required skill mix to deliver the service improvement and reform mentioned, and we will set out further detail as part of our medium-term approach to health and social care renewal, which we are committed to publishing before summer recess. Some of the change that is required is already taking place, including, for example, in relation to pharmacy education, where all graduates will be independent prescriber trained at the point of registration from 2026. This, coupled with our planned expansion of Pharmacy First, presents a new opportunity for patients to benefit from this expertise and to free up general practitioners to focus on the care that only they can provide. And our budget will also enable an increase in our domestic intakes to university dental courses by 7%, ensuring that we build a strong workforce pipeline into the medium and longer term. With regards to medical undergraduate places, we have increased these by 300 since 2021, while offering alternative routes to medicine as a career and doing more to ensure that we are supporting a pipeline of doctors for our remote and our rural and island communities. Retaining and recruiting GPs is vital, and we remain committed to increasing the number of GPs. There are currently over 5,000 in Scotland, and since 2017 we have increased that number by 307. There are just over 1,200 GPs in training in Scotland, which is encouraging, and we have published a GP recruitment and retention plan with actions that will support the attraction and retention of general practitioners, with new work on expanding fellowships and new flexible retention schemes. We're also due to publish the report of the Nursing and Midwifery Task Force, focused on recruitment and retention, in the coming weeks. And finally, through the continuation of the National Care Service via the establishment of an advisory board, we will continue to support improvement and innovation across the system, with a clear focus on national and local workforce planning, high-quality learning, development and leadership support for social care staff. Of course, growth in the workforce alone cannot be the solution to the challenges ahead. We must also take account of emerging opportunities to enhance workforce productivity and well-being, including reducing workload through the use of new technology, which Mr Whittle referenced, and enhancing the quality of care for patients across the country by utilising the expertise of our staff in different ways. That's why last year we published Improving Wellbeing and Cultures, Working Cultures, setting out our ambition to enhance working cultures across the system, and are continuing to support national wellbeing, leadership and equalities interventions. That approach and the support that is offered has been and will continue to be shaped by the voices and lived experience of our staff. The Joint Social Services Task Force has also taken forward important work, looking at a range of opportunities to improve the experience of our valued social care, social work and AHP staff. Both are great examples of the practical steps that we are taking to support the workforce, both of today and tomorrow. The immediate steps that I've outlined are critically important as we seek to improve the experience of staff working in our hospitals and communities on a day-to-day basis, and they form part of a comprehensive package which will allow us to deal more effectively with the immediate challenges the system faces, whilst at the same time supporting staff to respond to the demands of the future. In closing, Presiding Officer, I would like to reiterate my heartfelt thanks to health and social care staff across the system for all that they do. While I'm the first to recognise that the system is not without its challenges, their efforts continue to make a real difference to the lives of the people across Scotland each and every day, and this Government will continue to do everything it can to support them.
Thank you, Cabinet Secretary. I now call on Sanders Gulhani to speak to and move Amendment 16252.2 up to around 7 minutes. Dr Gulhani.
Declaration of interest. I am a practising NHS GP, and I speak today not only as a politician, but as someone who has witnessed firsthand the consequences of years of SNP mismanagement in our health and social care sectors. There's groaning from the back of the SNP benches, but they should listen to this. 18 years. This is how long the SNP has had to deliver on its promises to improve Scotland's NHS and support Scotland's health and social care workforce. And yet, here we are again, discussing the same problems that have worsened under their managed decline. A decade and a half of failure, inaction and neglect has left Scotland's health service at breaking point. Under Neil Gray's tenure as Health Secretary, our NHS has been allowed to slip further into a permanent crisis. Waiting lists have hit record highs, with 1 in 6 Scots now stuck waiting for care. Over 9,000 patients have been left languishing on waiting lists for more than 2 years. 2 years, Deputy Presiding Officer. These are not just statistics. These are our family, our friends, our communities. Patients are waiting in A&E departments. Recent figures revealed around 40% of A&E patients are not being seen within 4 hours, a target the SNP hasn't met anywhere since July 2020. Meanwhile, Scotland has the lowest life expectancy in Western Europe, and delayed discharges are at a record high, occupying 650,000 hospital days in 23. This is the SNP's legacy: unmet targets, broken promises, and a health service in decline. And let's not forget cancer treatment waiting times, another area where the SNP has failed miserably. The target to start cancer treatment within 62 days of urgent referral has not been met in over a decade. This is utterly unacceptable. Deputy Presiding Officer, it is clear that one Health Secretary after another has failed Scotland, and this includes the current office holder, Neil Gray. But the problems go far beyond his incompetence. They are systemic, the result of a government more focused on excuses than solutions. When Neil Gray himself admitted there was nothing new in his last plan to prevent the NHS from winter collapse, he effectively confirmed everything that we already know. He has no vision, no leadership and no ideas. What is his role now if John Swinney must step in to clean up his mess? John Swinney's sudden involvement as Interim Health Secretary speaks volumes about the SNP's lack of confidence in its own Health Secretary. During John Swinney's empty rhetoric speech, which was heavy on spin. Our NHS staff and patients deserve a Health Secretary who is not sidelined by their own government and distracted by personal scandals. But the blame does not end with Neil Gray. For 17 years, the SNP has failed to plan effectively for Scotland's health and social care workforce. Staff are the backbone of our NHS, yet they've been treated as an afterthought. Nurses, doctors, social care workers are burning out under the strain of staff shortages, increased demand and insufficient resources. We have seen moral injury among our healthcare workers. Dedicated professionals working in a system under the SNP that has treated staff like expendable resources rather than the essential lifeblood of our health service. Social care remains in chaos and patients are paying the price. Just look at their handling of their flagship policy, the National Care Service. We could see how flawed it was, so could the trade unions, COSLA and other experts. But the SNP pressed on regardless, led by an overmatched, though self-assured Minister for Public Health, that flushed £30 million down the drain, which could have gone to the front line. This is what oblivious incompetence looks like. As Matt McLaughlin of Unison put it, John Swinney promises are little more than re-announcements of pledges that the SNP has already failed to deliver. Colin Poolman of the Royal College of Nursing described the state of Scotland's hospital as distressing, with staff forced to provide patient care in corridors and other inappropriate locations. And Dr Ian Kennedy of the BMA warned that without urgent reform, the NHS might not survive another year. Presiding Officer, we cannot afford more dithering from the SNP. The Audit Scotland report could not have been clearer. There is no credible plan for NHS reform. Instead, the SNP continues to lurch from one crisis to the next, with no strategic vision and no leadership. This government is failing both patients and staff. Deputy Presiding Officer, we in the Scottish Conservatives are not just here to criticise, we are here to propose solutions. We have a policy paper, Modern, Efficient, Local, where we would implement a 10-year workforce plan that prioritises recruitment, retention and support for frontline staff. We would reinvest the funds wasted on the SNP's failed National Care Service into localised, effective social care. Mental health spending would reach 10% of the NHS budget, ensuring support for the growing number of Scots struggling with mental health issues. And we would hold the Scottish Government ministers and NHS managers accountable for their failures and focus resources where they are needed most. We would also take decisive action to reduce waiting times by standardising best practice across Scotland's hospitals, introducing initiatives like Super Saturdays for elective surgery and making better use of off-peak scanning. Deputy Presiding Officer, it is time for change. The SNP has had 18 years and they have failed. Patients are suffering, staff are burned out and our NHS is on life support. Neil Gray is not the answer. He is not the leader that Scotland's health service deserves. Today we urge Neil Gray to do the right thing and resign as Health Secretary, and Marie Todd, who said she was in charge of the flagship failure of the National Care Service, to be held accountable. Although I won't be holding my breath that this SNP government will do the right thing. The people of Scotland deserve better leadership, better care and a better future for our NHS. And I move the amendment in my name.
Thank you, Dr Gohani. I now call on Gillian Mackay, who joins us remotely, around 6 minutes. Ms Mackay.
Thanks, Deputy Presiding Officer, and I should start by apologising to the Chamber. My Surface has had a moment with Zoom over the past 5 minutes, so you're currently propped up on my phone while I try and do this speech ahead of hopefully getting it fixed ahead of my closing. I want to thank Labour for bringing this important debate to the Chamber and hope that together we can recognise the importance of our health and social care workforce. Often, and despite their dedication, they continue to face significant challenges that not only require urgent attention, but also concrete action. And my hope is that today we can use this opportunity to highlight the key issues raised by those working on the front lines and discuss the steps needed to ensure a sustainable and effective workforce for the future. I wish to start by talking about mental health, and I'd like to thank SAMH for their support and their briefing ahead of the debate this afternoon. We know that access to timely mental health support remains a serious concern in Scotland. The ongoing lack of meeting the 18-week waiting time for both NHS psychological therapies and CAMHS points to a system struggling to meet demand. And while there has been a 69% increase in the NHS psychological services workforce over the last decade and a 128% increase in the CAMHS workforce since 2006, demand continues to outstrip capacity. This is particularly evident in the lack of community-based mental health provision and the vacancies in some health boards, including Forth Valley Health Board in my region, who have a significant number of psychiatrist roles unfilled. The Scottish Government's Mental Health and Wellbeing Workforce Action Plan sets out some priorities that are welcome generally, including a commitment to evidence-based workforce planning. However, SAMH points out that there are clear gaps that need to be addressed. The plan doesn't provide essential benchmarking or mapping, nor does it set out targets or an assessment of workforce needs. It also fails to fully recognise the third sector's vital role in delivering mental health care treatment and support. SAMH poses a question to the Scottish Government if they will conduct a needs assessment of the mental health workforce, including the third sector, to establish clear targets. Additionally, we need to see government guarantee sustainable funding for third sector mental health providers who are doing huge amounts of work. In the 2021 programme for government, a commitment was made that by 2026, every GP practice would have access to a mental health and wellbeing service, backed by funding for 1,000 additional dedicated staff. This was to be supported and welcomed by with an annual investment of £40 million by 2024 to 25. However, it's disappointing that this commitment has been paused due to financial pressures, and I hope that with additional money coming from Westminster, we'll see it restarted. As of March 23, 17% of GP practices across Scotland reported having no access to mental health workers. The need for investment in primary care is clear, and we must ensure that people can access the mental health support they require at the first point of contact. The Royal College of GPs has also shared some important information regarding GPs. The single most impactful outcome for primary care would be an increase in the number of general practitioners measured by whole-time equivalent rather than just headcount. Data shared by the Royal College of GPs and originating from the GP Workforce Survey revealed that the number of full-time equivalent GPs has actually decreased, with a reduction of 0.7% between 2023 and 2024. Since 2015, the WTE GP workforce has declined by 4.2%, while the number of full-time equivalent medical and dental consultants has increased by 21.2%. This divergence is particularly concerning given that GPs carry out 90% of NHS patient consultations on any given day. Some progress has to be recognised, and the Royal College of GPs welcomes the Scottish Government's General Practitioner Recruitment and Retention Action Plan. However, and similar to other plans, they stress that it must be adequately resourced and effectively implemented. And workforce and workload data for Scotland's GP workforce remains poor. The number of GP practices in Scotland has already decreased, reflecting a concerning trend towards fewer practices overall. Evidence consistently shows that countries with strong primary care systems have better health outcomes and lower rates of unnecessary hospitalisations. The RCGP has also welcomed the First Minister's recent speech on renewing the NHS and his commitment to increasing the proportion of new NHS funding allocated to primary and community care. However, we need to see this progressed at pace. The BMA highlight their ongoing frustration with Scotland's workforce plans, which have lacked, in their opinion, the necessary detail and long-term solutions. They continue to call for a comprehensive plan that sets out the required number of doctors in both primary and secondary care, along with clear strategies to improve recruitment and retention at every stage. Alcohol Focus Scotland are calling for urgent action as many feel undervalued and at risk of burnout. The Alcohol and Drug Workforce Survey highlighted high workloads, large caseloads and heavy performance reporting burdens. Among respondents from statutory services, 63% reported feeling under pressure most of or all of the time. Additionally, Audit Scotland has noted slow progress in implementing the Scottish Government's Drugs and Alcohol Workforce Action Plan, particularly in workforce mapping and developing a competency framework. Scotland's health and social care workforce is the very backbone of our country's well-being, yet across mental health, primary care, general practice, social care and addiction services, we see challenges, staff shortages, unsustainable workloads and a lack of long-term workforce planning. Reform and workforce planning need to happen at the same time, and we need to ensure that we have the workforce to sustain and improve services and produce the workforce plans we need to see and realise ambitions on reform. Both have to be done at the same time, otherwise we'll continue to have services that struggle to meet demand. I welcome the First Minister's renewed focus on supporting and strengthening the NHS. His commitment to increasing the share of new NHS funding directed to primary and community care is a step in the right direction. But now is the time for the Scottish Government to deliver the solutions, investment and commitments that our workforce and the people they care for deserve.
Thank you, Ms Mackay. I now call Alex Cole-Hamilton, around 6 minutes. Mr Cole-Hamilton.
Thank you very much indeed, Presiding Officer. I'm very grateful to the Labour Party and Jackie Bailey for making time in the Chamber this afternoon for this important debate. And hardly a day goes by, Presiding Officer, I'm sure this is the case for all members in this Chamber, where I don't receive an email or a phone call or a visit to the constituency office from someone who has been waiting for months, often in pain, for a routine operation or procedure, weeks for an important diagnosis, or days just to speak to someone on the phone at their GP surgery. It's part of our day job, but it's also part of our daily life, our personal life. Before Christmas, my father had a significant health event in October. He went for scans, but it was 3 weeks before those scans were properly looked at because there were no consultants available to process his readings. He is in mortal danger and still waiting for a procedure that will make him well. And I've lost count of how many debates like this we've had over the last few years, and yet the frighteningly long waiting lists just aren't getting shorter. Patient experience is not getting better. Our NHS is on its knees. It's in dire states, and we cannot afford, we simply cannot continue merely just to talk about how bad things have become. We need to see some meaningful action to make things better. Better both for the patients who rely on our health service and our hard-working doctors and nurses and support staff who are on its front lines and who on a daily basis are under increasingly difficult circumstances. None of this is their fault. In fact, they were having to bear the brunt of it on a daily basis, and many are at breaking point. They're the first point of contact for frustration and for the patients who can't be seen. That is laid bare by the large increase in absence due to mental ill health and to staff burnout. At the heart of this are the ongoing workforce issues, which we've heard well versed in the debate this afternoon already, and in particular this SNP's government's failure to properly plan ahead in terms of workforce planning. And you don't need to take my word for it. In response to the First Minister's speech on NHS recovery this week, the chair of BMA Scotland said, and I quote, "There is now an urgent need for a plan to deliver the kind of reforms that are required to make the Scottish NHS sustainable for generations to come." And they went on, "We still lack the detail and comprehensive vision needed to make any plan a reality." We still lack the vision. This government's been in power for nearly 2 decades, and they have no vision as to how to make this right. And a BMA survey that ran just before Christmas was utterly damning. 70% of respondents said that they believe the health service is operating on crisis mode all year round. All year round, not just in the winter months, Presiding Officer. 84% don't think the NHS is staffed adequately to cope with winter pressures. 86% have no confidence in the Scottish Government to put the NHS on a sustainable long-term footing. And the personal impact of this is huge, is demonstrable. I know one person in Glasgow who had worked as a midwife for 30 years. She quit last year due to the utter mental and physical exhaustion and a chronic lack of safety on the ward due to inadequate staffing. It's happening again and again and again. And last month, an investigation revealed that mothers and babies at the Simpson Maternity Unit in Edinburgh came to harm, in part due to short staffing. 17 safety concerns in total were flagged, and the toll of the situation has been taking on staff is evident by a 200% increase in absence due to sickness. Across the NHS, we're seeing the same vicious cycle at play. We know from Unison Scotland, in a survey they conducted, that stress and burnout are also primary causes of sickness absence among social care staff. With survey respondents saying things like that again and again, this has been exacerbated by staff shortages, having to work long hours. It's the same story. Presiding Officer, we have to start undoing the damage caused by this government's mismanagement of our health service for the entirety of its tenure. Liberal Democrats believe we need to make a serious about-turn if we are to finally alleviate this crisis, this state of perma-crisis we are being warned about every week, and take steps in the right direction. We need to retain existing staff by making working for our NHS less of an ordeal. We want government to get to grips with recruitment, something successive health secretaries have singularly failed at, both in our NHS and the social care sector that underpins it in our communities. And we can no longer rely on agency staff to fill the gaps and to put out the fires. I'm pleased that the government is finally listening to the Lib Dems, who have been opposing the ill-fated National Care Service from day one and are no longer attempting their ministerial takeover of our social care sector. That will save hundreds of millions of pounds. There's no question about that. Money that is so desperately needed to make care a profession of choice on the front line once again. Presiding Officer, everyone is entitled to fast access to their GP, a wider range of skilled local healthcare staff that should increase access to mental health support and physiotherapy. That's why my party have fought for and won extra funding for both social care and local healthcare in the coming budget. Supporting primary care is one of the routes out of the crisis, there's no question. And the government must also finally listen to our calls, Lib Dem calls, for a staff assembly that puts the experience, the lived experience and expertise of frontline staff at the forefront of designing a solution and a pathway forward. And let me finish with this. Though I'm glad that this week the First Minister finally admitted to the crisis that is engulfing our health service, let me be clear, the real change our NHS needs, the real change hard-working staff and patients waiting in pain need, indeed the real change Scotland needs, is a change of government. Thank you.
Thank you, Mr Cole-Hamilton. We move to the open debate. Just for the avoidance of confusion, Labour Party members have opted for more but shorter speeches. And with that, I call Carol Mochan, around 4 minutes, to be followed by Christine Graham.
Thank you, Presiding Officer. Broken promises, missed targets, poor delivery and lack of ambition. This is the truth behind the SNP NHS. Ask any constituent. They all have a story about the dedication of the NHS staff, but the dismal failure of this SNP government. This SNP government has fallen short on so many national commitments, it's simply too hard to keep track of all its failures. Today, I, along with many other Scots, feel what can only be described as frustration. Frustration over this government's inability to deliver many of its pledges and develop an NHS fit for our future, fit for our patients or fit for our staff. Presiding Officer, the government cannot argue with the facts. 1 in 6 Scots is on an NHS waiting list. Over 5 million bed days have been lost to delayed discharge in the last decade. Scotland has the worst life expectancy rates across the UK and one of the worst in Western Europe. Of course.
Marie Todd.
Thank you, Presiding Officer. I just want to correct the record. I think it's really important that we have a healthy debate here today and discuss the actual facts. So I recognise that people are waiting too long, but it is factually inaccurate to suggest, as Carol Mochan has and as Sandish Galhani did as well, that nearly 1 in 6 Scots are on NHS waiting lists. Public Health Scotland had to correct that publicly. That causes alarm to our public. I would ask the member to correct the record.
Carol Mochan, I can give you that time back, but interventions are going to have to be
Thank you, Presiding Officer. 863,000 people are on waiting lists in Scotland. And Scotland does have the worst life expectancy rates across the UK and worst in Western Europe. Under this SNP government, we have had widening inequality. Our National Health Service is crumbling, and the member has to accept those points. Staff are forced to deal with rising demand without sufficient planning or action from government to help. And this is not just MSPs in this chamber saying this. It is respected professional bodies from the Royal Colleges, from the medical profession. The BMA, in its briefing today, says that there is no serious plan. The Scottish Government are failing to provide a true picture of the stark reality of the challenges in recruiting and retaining senior doctors. Now, the latest Royal College of Nursing report has been mentioned. The report on corridor care highlights the damning consequences of this lack of planning, and it has become accepted in hospitals that this is the way we are caring for patients. Staff are caring for multiple patients in single corridors, unable to access oxygen, cardiac monitors and other life-saving equipment. Nurses have reported feeling ashamed, demoralised and distraught that they cannot care for patients in the way that they have been trained to do and that they deserve to be cared for. It is frankly shameful that things have gotten as bad as they have, and it is undeniable that NHS staff and patients are bearing the brunt of government failure. How do we solve a workforce crisis which has cost the taxpayer over £9 million in spend on temporary nurses, locum doctors and consultants, when this government clearly lacks ambition and it lacks competence in workforce planning? Ineffective planning has led hard-working staff to breaking point, and Scottish Labour have been telling the government this for years. Graduates cannot get jobs. A lack of staff has meant remote and rural communities continue to experience inequalities when accessing services. This is why the Parliament tonight must support the Scottish Labour motion. The Government needs to develop a 10-year health and social care workforce plan, one which meets the needs of the people of Scotland. The people of Scotland are crying out for a new direction. They deserve a lot better than what this SNP government is delivering, and I hope that members will support this motion in the Parliament tonight to move things forward. Thank you, Presiding Officer.
Thank you, Ms Mochan. I now call Christine Graham to be followed by Neil Bibby at around 6 minutes. Mrs Graham.
Thank you, Deputy Presiding Officer. In my view, there are 4 key determinants affecting the pressures on and delivery of health and social care in Scotland today. COVID disrupted delivery of health services for a period of 2 years. It brought with it its own direct impact through deferred diagnosis, increases in mental health issues, as well as long COVID. It meant that cancer was being diagnosed at a later, more critical stage, and so on. Many health services were paused during lockdown, which impacted on health inequalities. Mental health was also impacted. The delivery of health and social care, therefore, today has also been profoundly altered. So the idea that COVID is done and dusted is for the birds. That page has not been turned. Brexit, too, had a long-term impact and has a long-term impact on recruitment and retention across both care and health sectors. It's been well documented. Scotland's demographics. As our population is getting older, there are now over 1 million aged 65 and over in Scotland, 20%. This is over 250,000 higher than the number of people under 15. Pressures on the NHS and care sector grow with ageing, as I know, having to use the NHS services more often. Then there's inflation, austerity, poverty. Inflation impacts on energy, food and building costs, just for starters, leading also to increases in the number of people falling into poverty levels. And thankfully, the Scottish Child Payment at £26.70 for each child under 16 in a family qualifying for certain benefits is helping. Now, too, in the coming winter, the winter fuel payment, £100 to all pensioners not on pension credit, getting rid of the 2-family child benefit cap, because poverty, of whatever age, inevitably leads to ill health, both physical and mental. Labour's Health Secretary Wes Streeting admitted when it comes to the NHS, funding Westminster is damaging Scotland's NHS because of austerity that we have suffered for 14 years. That page hasn't been turned. Wes can add that to the impact and the hike in employers' national insurance contribution, which will impact across health and care sector. And I know there are GP practices not taking on GPs because of that national insurance hike. So these 4, COVID fallout, Brexit, demographics, inflation and austerity. Well, let me start with the most important in our health and care workforce. who became in each and every one a hero during COVID. The Scottish Government values them, and so do I. And that's why Scotland remains the only country in the UK to have successfully averted NHS strikes over pay, because the pay deals offered by the Scottish Government played a crucial role in retaining Scotland's NHS workforce, recognising their value and improving their well-being. In September, unions voted unanimously to accept the pay uplift of 5.5% for 2024-25, an investment of more than £448 million in 24-25, taking the total investment in the past 2 years to over £1 billion. The Scottish Government puts its money where its mouth is. Contrast in January 2024, junior doctors in Labour-run Wales saw the cancellation of 6,500 outpatient appointments and 400 planned operations, undoubtedly impacting on waiting times. That was dwarfed by the situation in England, where over 1.5 million medical appointments were cancelled due to strike action between March 23 at an estimated cost of over £3 billion. I began by stating that delivery of health has since COVID changed, and sometimes for the better and sometimes not so. For the better, increasing demands have led to innovatory improvements such as Hospital at Home, piloted in the Scottish Borders, which has just received the bulk of the national pot at £600,000. It does what it says on the tin and is delivered depending on clinical suitability and, of course, the consent of the patients, mostly elderly. Over 90% who opted for this thought it was grand to be in their own home, and of course it freed up much-needed beds. Similarly, Pharmacy First, another innovation, and it's going to be expanded where the appropriately qualified pharmacists which can allow community pharmacies to give people expert help for treating conditions such as sore throats, earaches and cold sores, diverting them away from GPs, diverting them away from A&E. 32% of the Scottish population used Pharmacy First in the most recent 12 months reported, April 23 to March 24. Early days, but good signs. On the downside, the pandemic exposed the inequalities across the care sector, despite the dedication of care workers themselves, who delivered care above and beyond and often didn't even go home. Yes, we do need to tackle this, and I would rather the National Care Service had been labelled National Care Standards, because it's about standards. I also find that accessibility to some GP practices is not the best. Being required to phone between 8 and say 10, then to have mostly a phone call from the GP and not a face-to-face appointment is not uncommon. This, of course, is a matter for that GP practice. These are private businesses in the main contracted with the NHS. So it's not a matter for the NHS and it's not a matter for the Scottish Government. It's a matter for that GP practice. I hope if we get the balance of shift to pharmacists, opticians and other allied health professionals, more and more GPs would revert to that personal touch. So I welcome this debate, but let's not ignore context. Whether it's pandemics, Brexit, an ageing population, inflation eating into NHS budgets, national insurance tax hike on GP practices and allied professionals, and increasing poverty, all of that matters, and you can't just ignore that in this debate. Thank you.
Thank you, Ms Graham. I now call Neil Bibby to be followed by Douglas Ross. Around 4 minutes, Mr Bibby.
Thank you, Presiding Officer. I welcome the opportunity to speak in support of the motion in the name of Jackie Baillie, which calls on the Scottish Government to urgently bring forward a 10-year health and social care workforce plan. Because, as Jackie Baillie said, we will not solve the crisis in our NHS if we do not solve the staffing crisis that is affecting patient care. As Alex Cole-Hamilton and Carol Mockin said, we are reminded by our constituents every day of the impact this is having on them. Just this week, I've been contacted by a concerned and terrified constituent who will have to wait 3 to 4 weeks just for results being sent to their GP from their urgent X-ray appointment. Situations like this induce even greater anxiety in patients. This is just one of countless stories I hear from my constituents day in, day out. And it's clear that despite the very best efforts of our staff, our NHS is in crisis, is inefficient, and on too many occasions is failing to get the basics right for patients. And one of those key basics is having enough beds. Presiding Officer, no wonder we are shockingly seeing people being treated in corridors when the number of beds have been significantly reduced over time by the SNP. Compared to 2012, There are nearly 100 fewer beds at the Royal Alexandra Hospital in Paisley. That's nearly 1 in 8. And the Vale of Leven Hospital has seen 1 in 8 beds cut during that time too. Over the last decade, over 60 beds have been lost at Inverclyde Royal Hospital. That's almost 1 in 6 beds. And as we heard from Jackie Baillie, a process that was started whilst John Swinney was Finance Secretary, and now we see John Swinney as First Minister plans for a further 22 beds to be cut at the RH in Paisley, with the proposed closure of Ward 36 for older adults. That is despite the views of nearly 6,000 local people who have signed a petition opposing the closure of this important ward. Serious concerns have been raised and so far have been ignored about the impact this will have on patients and the pressure it would put on the wider hospital. There should be a full public consultation, but there hasn't been any, and the Health Board are pressing ahead with their controversial plans. Unison reps at the RH tell me they want to work in partnership, but not on the closure of this ward. The Scottish Government therefore need to intervene. Presiding Officer, we heard from Jackie Baillie that the Cabinet Secretary and the First Minister had a meeting last week to discuss the NHS, but regrettably did not invite Unison. Well, Unison reps who raised concerns about staff morale at the RH want to meet the Cabinet Secretary to discuss the need for a consultation and to keep Ward 36 open. I've said repeatedly that the Cabinet Secretary should attend sporting events where appropriate, but frankly, if he's got time to attend football matches and intends staying in post, then surely he's got time to take the ministerial car to the RH in Paisley and meet representatives of the staff there who are working on the front line. If it helps, we can call it a boxing match. And I look forward to hearing from the Cabinet Secretary whether he will take time to accept this invitation or duck it from NHS staff. Presiding Officer, I've also spoken to some of the workers at Inverclyde Royal Hospital who are deeply concerned about the impact on staffing shortages there. The Accident and Emergency Department there do not have enough staff, particularly at night. And the over-reliance of agency staff working in the A&E department, who through no fault of their own aren't familiar with working there, creates what the staff have warned is a dangerous situation. This sticking plaster approach is simply not good enough. And whilst they've not seen incidents of corridor care, they have seen instances of care in ambulance queues at Inverclyde Royal, which is putting even more pressure on our ambulance service. Presiding Officer, they, like their counterparts at the RH, are working extremely hard in difficult circumstances. The reality is, Presiding Officer, the common denominator here in these situations is SNP mismanagement. The NHS workforce, patients and our constituents deserve better. Our NHS needs a new direction and a proper workforce plan.
Thank you, Mr Bibby. I now call Douglas Ross to be followed by Bob Doris. Up to 6 minutes, please.
Thank you very much, Presiding Officer. I welcome the fact that Labour have brought forward this debate today. It's important that we discuss the NHS and lengthy waiting times, just like I welcome the fact that it was Scottish Conservative debating time last week that looked at rising violence in our schools and education. And I think it's quite telling that it's the opposition parties that are bringing these issues to the Chamber. And when Christine Graham spoke about context, I thought one area that she missed was context that we don't discuss this enough is the fact this is about the SNP's record in government over the last 18 years. It's the reason this always comes from the other parties, because the SNP don't want to defend their record or they can't defend their record. This is an issue that is vitally important. And I know we have statements, I know we have questions, but yet again, on the crucial issues for our constituents, it is coming in opposition debating time to hold this government to account. I'll briefly give
Cabinet Secretary.
I recognise that we debated the investment that we're making in public services just yesterday.
Douglas Ross.
The SNP love to have these general debates. This is a very specific debate about waiting times in our NHS, the crisis in our NHS and social care. They like the general debate because they can pick and choose the bits that they can defend best. This is the SNP's record on show here, and it does not make pretty reading. I would give way, but I've only got 6 minutes. A lot of members have spoken about individual constituency cases today, and I want to add to that, because the shocking waiting times are simply that. They are shocking and they are unacceptable and they are indefensible. So one issue that I wrote to the Cabinet Secretary about earlier on this year, and I got a response to on Monday, is a constituent who came in to speak to me about her referral from her GP to see a gynaecologist. And she then phoned up the department within NHS Grampian to get her appointment, and she was told the waiting time. And I'll come on to that at the end of this. But I got a lengthy 3-page letter from the Cabinet Secretary, which starts off with an apology. He accepts things are not good enough. He finishes his letter by saying, "I understand that she, my constituent, will naturally be concerned by the delay. However, please be assured her treatment and care is the utmost priority for the Scottish Government, and I fully expect NHS Grampian to schedule your constituent's appointment as soon as possible." My constituent has been told, following a GP referral to see a gynaecologist, the waiting time is 2 years and 7 months. Is that really as quickly and as soon as possible, Cabinet Secretary? Do you honestly believe that she could read your letter and think that her treatment is of the utmost priority for the Scottish Government and NHS Grampian if she is going to wait 2 years and 7 months to see a gynaecologist? I'll come on to another case that I've written about, and I've had a response so far from NHS Grampian. This is a constituent who I met in Elgin, who by the stage she spoke to me had already suffered significantly, and she struggles to sleep because she has issues with sleep apnoea. She went to her GP and she has been referred to the sleep apnoea clinic in Aberdeen within NHS Grampian. Again, from the Health Board, we get an apology. They accept things are not good enough. She was referred by her GP on the 2nd of June 2023. So now, well over 18 months ago. She's been told, and I quote from the letter from NHS Grampian, "The current waiting time for a routine appointment is over 5 years." How can people go to their GP in Scotland to be told your issue does need to be seen by a specialist, to have been waiting 18 months to not know anything, to contact their representative, to then the representative have to go to them and say, well, this is what I'm getting from the Health Board. A further 5-year wait to be seen at that clinic. As I said at the beginning, these are unacceptable and indefensible. On the National Care Service, I think the Conservative Amendment is right to look at the shambolic nature that we have seen in this Parliament at the attempted passage of that bill. I was reminded earlier, I raised this before, but it was in May 2023. Marie Todd told the Health and Sport Committee that it's been a little hard for her to get her head around the issues of the National Care Service. Neil Gray is shaking his head. That was what the Minister at the committee scrutinising that bill was telling people. Even the Minister in charge was struggling to get her head around it, yet £30 million later and a lot of money down the drain, it had finally been dropped. But there were so many warning signs. If the government just hadn't been so determined to forge through their views and listen to Parliament, listen to COSLA, listen to others, we would have been in a better situation. And in the final minute, I've got to address a point that I've tried to get answers on, because the Cabinet Secretary's future revolves around trust. He needs to ensure he has the trust of this chamber and health professionals out with it. But he has still not been straight on the issue around what he knew about his misleading this Parliament and his correction of the record. So can the Cabinet Secretary now answer the question that John Swinney avoided last Thursday and Jamie Hepburn avoided last Wednesday? When did Neil Gray know of the responses to the Freedom of Information requests, which showed there were no minutes of the meetings he said did exist? When was he made aware of that? Because that was the point he became aware he had misled Parliament. Would Neil Gray like to set the record straight on that point today? He won't. He stares straight ahead. At some point, Mr Gray, you will have to answer these questions. I don't know why you won't take the opportunity today to set the record straight.
Mr Ross, could I ask you just to resume your seat for a second? I mean, you will be well aware, Mr Ross, knowing the procedures of the Parliament very well as you do, that obviously challenges to the accuracy of opinions and facts are perfectly in order. But the Chair will not tolerate an accusation that a fellow member has been deliberately untruthful or knowingly misled the Parliament. I just put that out there, and I hope that you were not intending to do either of those two things.
I genuinely wasn't, and if I said that, I apologise, because Neil Gray did correct the record, and that was the point I was trying to make. The question is, did he do it as soon as he became aware? He's chosen not to set the record straight in the chamber today. I think he will have to at some point. Presiding Officer, in conclusion, patients deserve better. But all they get from this SNP government at the moment is deflection, dithering and denial. They need a health service that delivers for them day in, day out. Under the SNP, and for the last 18 years, it has not. It must and needs to get better.
Thank you, Mr Ross. I now call Bob Doris to be followed by Polly McNeill. Up to 6 minutes, please, Mr Doris.
Thank you very much, Presiding Officer. I very much welcome this afternoon's debate, which, once we remove the raw politics clearly at play, is actually a hugely important debate about how we support Scotland's health and social care sector to deliver for the communities that we all serve. There is also, and just whisper it, Presiding Officer, probably a broad agreement that in addressing the significant pressures and challenges that clearly exist, we must ensure an appropriately structured, skilled, resource health and social care workforce that sits at the heart of any solution. Now, the Labour motion speaks of urgently bringing forward a 10-year health and social care plan. Well, at face value, some might say, absolutely. However, what the Labour motion completely fails to acknowledge is that much of what they are calling for is already well underway by our SNP Scottish Government. And that's because in March 2022, the Scottish Government published a National Health and Social Care Workforce Strategy, a strategy I had a look of ahead of this afternoon's debate. What I would say is that whilst the strategy appeared very detailed and thorough, I noted with 71 short-term, 26 medium-term and 12 long-term action points, it would clearly benefit from a clearer, more slimmed-down approach to summarising that strategy and being focused on clear milestones for delivery. But there's some really good stuff in it. Some points would be reference to acute oncology. We've heard about cancer in the chamber this afternoon. We've heard about staff retention. There's a health and social care career pathway endeavour within it. And we've heard about ambulances and paramedics. There's plans to recruit more paramedics. So real concrete stuff within the strategy that already exists. Indeed, given that strategy was published in 2022, it may benefit from a refresh, and I would welcome details from the Cabinet Secretary as to how that strategy is monitored, how delivery is tracked, and how it links into the Scottish Government's commitment this afternoon in its amendment for the publication of a medium-term approach to health and social care reform, including, including workforce planning before the Parliament's 2025 summer recess. Now, I wholly agree with that its aim is delivering reforms to ensure that everyone can access the treatment and care that they require, the right place at the right time. Now, I'm not sure why Labour would not acknowledge that the strategy within its motion, so therefore a motion that's fatally flawed at its outset, well, by calling for a strategy that, well, already exists and has been built on by our SNP government. Crazy stuff. Now, workforce strategies have to deliver results, and we all agree that that remains work in progress. However, with nursing numbers increasing each and every year for the last decade, and an additional 153 training posts for junior doctors in 2023 alone, that's an extra 880 training places in the last decade. There are two examples of where that is indeed working. Much more to be done, I absolutely acknowledge. Indeed, it's not enough to train more clinicians, but we need to retain them also. I have no doubt the 5.5% NHS pay lift for Agenda for Change healthcare staff, making them the best paid in the UK, will assist in that endeavour. That was an additional £448 million investment in the last year, an extra £1 billion over the last 2 years. What I would ask the Scottish Government, however, their summing up is that given Labour's tax grab on our public services with our national insurance raid, whether that may impact on how many more staff we can recruit in the future within Scotland's NHS and social care sector. Will Labour's national insurance grab, will it mean more or less doctors, more or less nurses, more or less social care staff? I think we need to know the answer for that. Now, the challenges facing health and social care in Scotland are not unique to our nation. They are replicated across the UK and beyond. And before I make this next point, let me be clear that it is no one else's responsibility to address those challenges other than ourselves here in Scotland. But sometimes context and perspective, as Christine Graham said, is very important. We see headlines in Labour-controlled Wales recently about Welsh hospitals waiting lists at record levels again. We also, at the turn of the year, if we remember, the Welsh Ambulance Service declared a critical incident across Wales. 340 NHS calls, 999 calls went wholly unanswered for a long period of time, and over half the ambulances in Wales stacked up outside hospitals because patients couldn't be transferred over. Now, Presiding Officer, let me be clear. I sincerely wish the Welsh Government every success in tackling these enduring, entrenched problems. I recognise the challenges they are under, just as we face those challenges also here in Scotland. To pretend the pressures facing the Scottish NHS and social care are unique to Scotland, or were solely created by the Scottish Government, is, to use the words of one Labour speaker, delusional. SNP Scotland and Labour Wales have been impacted hugely by Brexit, by COVID and by UK austerity over many years. That is why, before Labour took power in the UK, the now UK Labour Health Secretary Wes Streeting was clear that all roads lead back to Westminster in relation to the NHS, but they get a whiff of power, they get in power in London and they forget about the reality of the matter and they play politics with Scotland's NHS and social care system. And that's why I will vote against Labour's motion this evening, and I will back this Government and this Health Secretary to turn our NHS and social care into the future we want to see for all the people of Scotland.
Thank you, Mr Doris. I now call Polly McNeill to be followed by Emma Harper. Up to 4 minutes, please, Ms McNeill.
So we've heard the Scottish Government is going to overhaul NHS waiting times and improve access to GPs. But it's already been widely criticised for recycling old pledges. The fact of this announcement is an admission that we cannot go on like this. The same old promises from a tired government, no detail. It is not a detailed plan for progress or reform. Whilst we've heard other speakers talk about every day we see patients are failed at every level of care because this government did not effectively plan for known challenges. There's lots of things in the 17 years in government that they did know about. People worry now about the times where they might be ill and need acute care, or they need an ambulance or a life-changing operation, because what they're witnessing all the time in their own communities is ambulances that can't get patients into hospitals that they've rushed to get there. Public confidence in our NHS is diminishing. And it's not the fault of the dedicated workforce who work tirelessly in the hardest of circumstances. I will give way briefly
Alex
Cole-Hamilton.
Very grateful to Pauline McNeill giving way. She just mentioned ambulances stacking up outside A&E and unable to discharge their patients. She recognised that's not a deficiency of emergency care, but the problem, a symptom of the interruption in flow caused by bed blocking as a result of no social care in our communities.
Pauline McNeill.
I don't have any difficulty in agreeing with that point that Alex Cole-Hamilton makes. But it is quite unbelievable now, the number of people who would never have dreamed of using private health care. And many are forced to use their own life savings to put their health first. And many can't do that at all. For basic operations like hip operations and knee replacements, people are very anxious about calling the GP for a simple appointment. People now have deep anxiety in itself when they are ill because they have to go through the 8:30 phone queue as the countdown starts. This must change, and I think it is a point at which Scottish Labour would openly say is something we'll work with the government on, but it must change and there must be reform. So while supporting the NHS remains unwaveringly high, with satisfaction levels with the NHS performance is seen as at a record low, but GPs themselves are crying out for the reform. They're asking the government to help them reform the system. They're willing to do more to broaden out the primary care services, the cornerstone of our NHS. And if they're given the power and the resources to do it, they will do it. GPs are natural problem solvers. And the studies of the British Journal of General Practice show that GPs can reduce mortality up to 30% if people get to see regularly their own GP. So that speaks for itself. But reform seems stagnant. There really is no excuse for not planning a decade ago for some of this. Whilst we may not have predicted a pandemic, although some people actually did, we knew there was an ageing population and we knew there was a mental health crisis. The short-term, piecemeal approach to investment and workforce planning has meant NHS Scotland has paid a heavy price, and it will take more than money to turn things around. Audit Scotland has said in a fresh report that the Government has no clear plan for NHS reform, while commitments to reducing waiting times have not been met, and the number of people remaining in hospital because the discharge has been delayed is the highest on record. So the chairman of the BMA, Dr Ian Kennedy, said at this stage, to emphasise the point, we lack the detail and comprehensive vision needed to make any plan a reality. And that is the point that the Government, in conclusion, Presiding Officer, need to convince the general public that not only do they have a plan, but people can have confidence in the detail of that plan and the 800 GPs they say they're going to deliver to transform the NHS that people love so dearly. Thank you.
Thank you, Ms McNeill. I now call Emma Harper to be followed by Tim Eagle. Up to 6 minutes, please.
Thank you, Presiding Officer. The SNP Scottish Government does value the NHS workforce and is committed to investing in Scotland's NHS workforce. The staff in our NHS are the backbone of our nation's healthcare, and I want to thank everyone for all the care and support that they provide. And I remind Chamber that I am still a registered nurse and a former employee of NHS Dumfries and Galloway. Presiding Officer, the challenges facing Scotland's NHS are not unique. Labour's Health Secretary Wes Streeting admitted that when it comes to NHS funding, Westminster is damaging Scotland's NHS because of the austerity that we have suffered for 14 years. He stated that all roads lead back to Westminster, and the NHS is in crisis, and all decisions that are taken in Westminster don't just affect England, but Wales, Scotland and Northern Ireland. Scotland is not alone in facing challenges related to our NHS, but the SNP Scottish Government is committed to ensuring our health service is not just the best in these islands, but the best it can possibly be. The Scottish Government is choosing to invest more than £21 billion in health and social care in 2025-26. This sees record funding to ensure that people have access to high-quality health, mental health and social care services, driving forward the vision of a Scotland where people live longer, healthier lives. The budget includes almost £200 million to reduce waiting lists and reduce delayed discharge, to ensure that no one waits over 12 months for a new outpatient appointment or day case treatment in March 2026. And I took a note about what Douglas Ross was saying about sleep apnoea and sleep apnoea assessment. I'm co-convener of the Lung Health Cross-Party Group, and we've taken lots of information around new AI technology that can be used to aid the assessment and then diagnosis in a more speedier way. So I look forward to hearing that NHS Grampian picks up this process, because it is being trialled in Inverness and other areas, including Dumfries and Galloway. We also have £16.2 billion allocated to frontline NHS boards to take forward the improvement of health in communities and assess and deliver the most effective care for the people they serve. There's £2.2 billion for social care and integration, exceeding our commitment to increase funding by 25%, over £350 million. No, I'm sorry, I will not take an intervention. £1.3 billion for mental health services, more than doubling direct investment since 2020 and 2021. And there's an additional £139 million in capital spending power, progressing Belford Hospital, Monklands Hospital and Edinburgh Eye Pavilion projects. And we did see £200 million spent by the SNP government to build a new hospital in NHS Dumfries and Galloway, the new DGRI. So, as well as sustained record funding to address the public health challenges of drugs and alcohol, including the commitment to provide an additional £250 million over the life of this Parliament. These commitments are, of course, welcome and demonstrate how the Scottish Government is working to address the challenges within our health service. The Scottish Government continues to address the challenges faced in our healthcare system, but at every step it's constrained by the UK Government of whatever colour. The impact of UK Labour's Government's increase on employer national insurance contributions is expected to be catastrophic for Scotland's social care sector. This is a change that was brought about without any understanding of how the care sector currently works, without any consultation with the stakeholders and without modelling the impact of the change. Donald McCaskill, the Chief Executive of Scottish Care, has called it the straw that breaks the camel's back. The Labour Chancellor's national insurance hike, others have mentioned it already, could impact public services in Scotland to the tune of £700 million, likely to cost social care sector in Scotland more than £84 million. This issue is clearly more pressing than any discussion about the medium and long-term improvement of our social care system. It is an immediate threat to our social care system in Scotland. The UK Government must cover the cost in full, no ifs, no buts, if Scotland's healthcare sector is to survive this catastrophic decision by Labour. Just like the UK Government has done to our farmers, our social care sector is now being shafted too. Presiding Officer, the Labour motion today makes reference to healthcare graduates not being employed by our NHS. This is simply not correct. The Scottish Government continues to support health boards to ensure that graduates can secure jobs and in roles in the NHS. And the Scottish Government's work in health boards to ensure that boards are maximising opportunities for newly qualified nurses to find employment. Under this Government, the number of qualified nurses and midwives has increased by 16.1%. And the Scottish Government's Nursing and Midwifery Task Force is working collaboratively with stakeholders to develop actions that will build a sustainable, attractive and respected workforce. The Scottish Government has increased Scotland's medical undergraduate intake from 848 in 2015-16 to 1,417 in 2023-24. This is a 67% increase in the number of available medical school places at Scotland's universities. And indeed, this SNP government conceived of and implemented the ScotGem programme to train the next generation of rural GPs, including across Dumfries and Galloway. And I welcome updates regarding ScotGem's progress. Yes, I am about to conclude, Presiding Officer. There is so much which could be said, but in closing, Labour again is talking down our NHS and their colleagues in Westminster are working to constrain it, while this Scottish Government continues to support our NHS to meet the demands of 2025.
Thank you, Ms Harper. I now call Tim Eagles to be followed by Rhoda Grant. Up to 6 minutes, please.
Well, thank you, Presiding Officer. And can I remind members that my wife is a GP? And can I congratulate Scottish Labour and Dame Jackie Bailey on holding this debate? And I associate myself with Jackie Bailey's comments that the staff really are a backbone of our NHS and something we should cherish. There's no doubt we are currently experiencing a crisis in both our NHS and in social care in Scotland. And I don't think that's because Labour are talking down the NHS. That's because the SNP have fundamentally failed to actually deliver what they needed to deliver. For example, we are increasingly hearing about how corridor care is now normalised. One Scottish nurse commented in the recent RCN report, "Department with a capacity for 13 beds, we had 40 in, with patients on chairs having treatments administered, also sitting in the waiting room on cardiac monitors, using privacy screens to put around patients to use a bedpan." And we have heard the warning from the BMA that the NHS will struggle to make it through another year without urgent reforms. Dr Ian Kennedy, the Scotland chairman, said, "Doctors have heard a lot of warm words recently from the First Minister, but words must be matched with a clear vision, a timetable for reform and action. The NHS as we know it will struggle to see out another year." I just want to pause on that statement. The NHS as we know it will struggle to see out another year. This is arguably our greatest institution, a source of national pride. Yet for too long, both staff and patients have been let down. So what are the SNP's priorities at this time? They have a Cabinet Secretary engulfed in a scandal, which is maybe dangerously distracting him, his office and the office of the First Minister, who is repeatedly having to come to this chamber to defend him. And an SNP government distracted by the disaster that is their National Care Service Bill. The SNP ignored the warnings of a raft of experts, including trade unions and local authorities, who argued from the outset that the NCS bill was fatally flawed, wasting £30 million with repeated delays and redrafts, only to now scrap the flagship part of it. That is £30 million that could have been spent on investment in remote and rural healthcare, especially in my region of the Highlands and Islands, where we are still waiting for the Belford Hospital in Fort William, for upgrades to Dr Gray's Hospital in Murray and the replacement hospital on Barra. I speak to a lot of medical staff. I also speak as someone that for many years during my time as a councillor sat scratching my head on the local IJB. We would be asked to shut community hospitals despite having no plan for the patients that went into them, meaning more patients ended up in community hospitals much further away, a long way from friends and family. Managers would tell us we should move to care in the community instead, but with little plan of actually to how to deliver that. I've seen health boards shut minor injuries units, de-skilling local staff, only to then add to pressures on ambulances and A&E departments. That led to more and more pressures being put on primary care. Now, Christine Graham has sadly left, but I was a bit shocked yesterday when Christine Graham stood up in the afternoon session and told me that the reason we can't get through to our GPs is because they are private practices. That's not the reason we can't get through. The reason we are struggling for GP practices, which I think Pauline McNeill pointed out, is that the failures of secondary care is putting ginormous pressure on GP practices, meaning more people are phoning and more people need appointments. So let's not blame GPs for the SNP's crisis in the NHS. My new boss, Russell Finlay, talks a lot about common sense, and I'm with him on that. I often wonder if we overcomplicate things. Why can't this government recognise the value of primary care, allow the profession itself to restructure? If we want more community care, then it makes sense GPs will be a big part of that. Money has to flow between secondary and primary care much more freely. Why can't this government change their attitude quicker to the caring profession, paying more, creating a better job structure, providing benefits, recognising this is one of the most important roles in our society? Why can't this government do more to put money we need into preventative health plans like Planet Youth? And if you don't know what Planet Youth is, I urge you to look it up. I am convinced it is a model that we can use to solve Scotland's alcohol and drug problem in young people by really getting behind sport and recreation. We all need to be more open about obesity and food and how we educate people young to old. We need to be better with mental health prevention and support, and I can't shout enough about putting more and better incentives in place to encourage a strong rural workforce and accept that rural healthcare does cost more, and we should widely encourage large urban centres to do more research, investment and pioneer medical technology, as I'm sure my colleague Brian Whittle will talk about in a minute. Some might say that we should have a modern, efficient and local health service that works for all, which just happens to be the title of my Scottish Conservative plan for the NHS, as mentioned by Dr Gohani earlier on. Everyone can see that the SNP have run out of road and out of ideas. Matt McLaughlin, Unison co-lead for Health, criticised John Swinney's recent health speech as being full of re-announcements of previous pledges. He said Swinney completely missed the key issue, which was how do we improve social care to make sure that the delayed discharge problem is tackled once and for all. The Scottish Conservatives are calling on Neil Gray to resign today. But in many ways I feel for him. A year in a job of what was always going to be a poisoned chalice under a tired and failing government. Our NHS staff and our communities all deserve better.
Thank you, Mr Eagle. I now call Rhoda Grant to be followed by Gordon MacDonald. Up to 4 minutes, please.
Thank you, Presiding Officer. This government continues to design and deliver services with urban areas in mind. The way in which training is delivered doesn't work for those who live in rural Scotland, forcing them from their communities to access training. And this means we're ignoring a potential workforce, while we know that those who leave to access training very seldom return. In the Highlands and Islands, we have high levels of consultant vacancies. Proportionally, NHS Western Isles has 41 vacancies per 100,000 people. NHS Shetland 37, NHS Highland 30 on the same proportional basis. And this mismanagement leads to eye-watering locum costs. It's difficult to attract staff to rural areas because the training does not equip trainees with the skills they need for rural practice. Training is based on super specialisms and working within teams, seeing a conveyor belt of patients. Whereas in rural practice, they need different skills, such as self-reliance and a breadth of knowledge. Yet a depth of knowledge is valued more highly in pay and status. But a breadth of knowledge is not recognised, and that's true not only of consultants, but also in all other health careers. And frankly, I'm not sure this works for anyone, because diagnosis can take much longer under the system we are pursuing. Super specialism also leads to centralisation when a huge cohort of patients with very specific conditions are needed to keep the specialist skill honed. Patients need to travel, and that comes at a huge cost for them personally and financially. Social care is also suffering from staff shortages. Between March 22 and April 24, 5 independent sector care homes have closed in Highland. And during this period, the public sector acquired a care home which was in administration to prevent its closure and the facility's further loss of bed provision. This meant that in Highland, at the end of April 2022, social care services were able to provide 14,497 hours of care each week between in-house and external providers. This has reduced to 13,423 by the end of February 24. That's a decrease of 1,074 hours in just 2 years. 2 years when demand is actually increasing. And this is placing pressure on hard-working staff who are leaving for better paid jobs and jobs that will give them less burnout. At the same time, in NHS Highland, a person experiencing delayed discharge is on average delayed by 88 days, with one patient experiencing delayed discharge for 4 years and 147 days. That is heartbreaking for the people involved. What hope for frailty teams where there is no alternative to hospital? There are, of course, more complex issues in attracting staff regarding housing facilities, services and the like. Things I've spoken to in this chamber again and again and sadly will no doubt return to, but I won't go into today. Presiding Officer, previous solutions have shown very little impact. The National Centre for Remote and Rural Healthcare, what is the impact? What is the outcome? What has it done? ScotGem has also only provided 2 GPs since 2016. I feel like these are diversions to take attention away from failures that actually do nothing. We know urban healthcare is in crisis, but rural healthcare is always lagging behind. We need to see both improved and a degree of equality in service provision throughout Scotland.
Thank you, Ms Grant. I now call Gordon MacDonald to be followed by Monica Lennon. Up to 6 minutes, please.
Thank you, Presiding Officer. And I remind members that my wife is an NHS nurse. Our NHS staff are fed up with the health service being used as a political football and a constant negativity from opposition parties and their friends in the mainstream media, continuing to undermine confidence of both patients and staff in our NHS. It may be that this is what this debate is all about, but it will come as no comfort to staff or patients. There are challenges in our NHS, but let's put them into some context about why there are challenges facing all NHS trusts and health boards across the UK. And it is across the UK. NHS England has 7.5 million on waiting lists, and NHS Wales hit a record 800,000 on waiting lists in October. So much for Labour having all the answers. They can't implement them in Wales. Presiding Officer, in May 2007, the SNP came to power and were immediately met with the global financial crisis, with major banks collapsing and UK government debt soaring under Labour, which ushered in 14 years of Tory austerity, with cuts to public spending and welfare, exacerbating inequality and increasing poverty and ill health, which in turn put further pressure on NHS finances and waiting times. Then Tory Brexit happened in 2016, which brought uncertainty in our relationship with the EU, changes in immigration patterns, creating labour shortages, especially in our health and care sector, with Home Office stats highlighting that there has been an 83% drop in health and social care visa applications. If that was not enough, we then had COVID-19 pandemic of 2020 and 21, which saw lockdowns, NHS staff falling ill and wards closing to stop infection spreading. The result, more delays and increased waiting times. Inflation and cost of living crisis of 2021 to the present day, caused chiefly by substantial energy price increases, again impacted on the NHS budget. Then there's a Labour job tax of around £140 million to come to the NHS from April. These difficulties continue to this day, but more importantly, what has the SNP achieved against this backdrop of economic crisis caused by Westminster mismanagement? Firstly, a doubling of the NHS budget from £9 billion in 2006-07 to £19 billion this year, with an additional £2 billion in the provisional budget for the next year. Compare that to the decision of Rachel Reeves in August to inform the Department of Health and Social Care in England to find around £1.3 billion of savings in advance of the budget. Presiding Officer, NHS Scotland's staffing levels have benefited from a long-term trend of workforce investment and growth. Since the SNP took office, there are 31,300 more doctors, nurses and other staff working in Scotland's NHS, an increase of nearly 25% since 2006. Qualified nurses on Band 5 have a higher salary than south of the border, do not incur tuition fees when training and do not pay hospital parking fees. That is why the Scottish Government has been able to increase student nursing numbers every year for the last decade. Capital investment in new hospitals, including the Royal Hospital for Children and Young People in Edinburgh, and in Glasgow, the Queen Elizabeth University Hospital, the biggest hospital in the UK with 1,667 hospital beds. In my constituency of Edinburgh Pentland since 2011, we have seen investment in primary care with new doctor surgeries at Collington Mains, Ratho and Wester Hales. People in Edinburgh will welcome that the budget includes funding to progress the replacement Edinburgh Eye Pavilion. On NHS waiting times, the ONS survey covering the UK asked, are you currently waiting for a hospital appointment, test or to start receiving medical treatment through the NHS? In Wales, 29% of people were on a waiting list. In England, it was 25%, and it was Scotland, it was 22%, the lowest in the UK. Compared to 2019, more people are seen within the CAMS target, more seen within psychological therapies, more being helped with drug and alcohol dependencies, and more being seen with the cancer diagnosis and starting treatment target. In accident and emergency, no health service anywhere in the UK hit the target 4-hour waiting time. However, the ONS analysis confirms that NHS Scotland is the best performing A&E services in Britain for well over a decade. This is backed up by the NHS Scotland, who highlighted in the year to September 2024, over 1 million patients were seen within the 4-hour
Member is
target.
about to conclude.
So let us take stock of where we are in Scotland's NHS. Record health spending, the best paid NHS staff in the UK, the highest number of qualified nurses and midwives in the UK, the highest number of GPs in the UK, best A&E services, 95% of people are registered for NHS dental care, the highest in the UK, free prescriptions, 96% of all hospital discharges happen without delay, expansion of hospital at home, ensuring that older Scots get the care they need at home. Yes, there are challenges, but there has been progress. Under the SNP, we're seeing a healthcare system that is more resilient, more compassionate and more determined than ever to serve the people of Scotland.
Thank you, Ms MacDonald. I now call Monica Lennon to be followed by George Adam. Up to 4 minutes, please.
Thank you, Presiding Officer. I don't believe that any member of this Parliament today has taken part in a debate to come here and talk down the NHS. not at all. And no one is denying that healthcare services beyond Scotland's borders face challenges of their own. But this is the Scottish Parliament, and our constituents send us here to improve their lives and make good decisions about their public services. It is evident from members' speeches that we all care deeply about the NHS and about social care. Scottish Labour will always champion our health and social care workforce. That is why we have secured this debate. And MSPs were not unique, but through our advice surgeries and our casework, we know more than most the challenges and pressures that people experience, the delays and the barriers, what it's like for people trying to access care, for their families and for the workforce. We heard a very poignant example from Alex Cole-Hamilton about his own father who has a health scare and is waiting anxiously for results. But that is sadly the case for all of us in terms of our casework. So let's not sugarcoat what is going on, because there is a lot to celebrate in the NHS, and I think Gordon MacDonald's given us a good reminder of that. But if we come here only to try and help out the government front bench and pretend that everyone's okay, we do a disservice to our constituents who are scared and who have sadly seen their loved ones die because they waited for an ambulance that didn't come, or they had to be parked in a corridor or cared for in a cupboard. That is the reality. And it's not a word I use lightly, but the term that comes to mind is permacrisis. This is not winter pressure, a seasonal issue. This is now the new normal for our NHS and for social care. But it does not need to be like this. So I would say to colleagues who want to spend their time describing waiting times and performance of other health trusts and other governments, think about your own constituents and think about the reality that they experience. That's who we have to get this right for. So Scottish Labour has come here today with solutions. We have rightly proposed a 10-year workforce plan, because for too long the SNP has failed to act in the long-term interests of the NHS and social care. I see it in NHS Lanarkshire, in Forth Valley and in Greater Glasgow and Clyde, the health boards that I deal with on a day-to-day basis, and people have had enough. In NHS Lanarkshire, almost 79,000 nursing and midwifery days were lost to mental ill health. That is the staff who are burnt out. They're at breaking point. What about safe staffing levels? Apparently we have legislation on that. When is that actually going to make a difference? NHS in Scotland has spent at least £900 million on agency nursing and locum doctors since 2019. The NHS is hemorrhaging money because of the SNP's failure to recruit and retain. And just in my final seconds, I just want to say a brief word about mental health. The children who are being let down, because not once has this government met its CAMHS targets of seeing 90% of referrals within 18 weeks. My constituent Karen McKeown from Bells Hill lost her partner to suicide. That has affected her life and her children. She fights for reform. She has a petition in this Parliament. I have to ask the Scottish Government, when will they actually get real? Respond to Karen and the many others like her who have had their lives destroyed because government is failing to listen and act in the long-term interest of this country.
Thank you, Ms Lennon. And I now call George Adam, who will be the last speaker in the debate. Up to 6 minutes, please.
Thank you, Presiding Officer. Presiding Officer, when you come to a debate like this, I tend to have an idea of what I'm going to say initially and how it goes. When you're at the end of the debate like this, I tend to kind of change things as the debate has moved on. But one thing that never changed throughout all of that was my appreciation for the work that those that work in health and social care do. They do a fantastic job, and they're very much appreciated by me and my constituents, even though everyone acknowledges they work in very challenging circumstances and environment. There's always a talk of the negativity, and I've got cases where we've had to work, complex cases, where we've had to work through the NHS and deal with some of the issues. But I give an example of Stacey's dad, is 86-year-old. He wasn't feeling great over Christmas and ended up, because over the period, ended up in the RAH with flu, with a whole stack of other individuals who, of a similar age, who were in there with flu. And how he was dealt with during that period was an example, and everyone else within his ward, was the fact that there was an issue, there was a challenge in numbers, but they managed to deal with it. And I think sometimes when we have these debates, we need to kind of balance this up and say that those that are working in health are actually delivering for our constituents. But one of the things that I find quite difficult to square is when you hear from the Conservative Party about how important this debate is, how they really want to, it's important we have this debate. Douglas Ross went as far as saying it should be in government time as well. But during two members' speeches here in the open debate, Pauline McNeill's speech and during Emma Harper's speech, there was nobody in the Conservative front bench. And for me, I think that sums it up for the Conservative Party. You know, they're here for their soundbite, for their wee bit of kind of argy-bargy, and then they go. They don't care for the rest of the debate. You know, we really need to use this opportunity to set this true state of Scotland's NHS and social care workforce. Let's look at Labour's motion. It's quite frankly a masterclass in political amnesia. They claim to support our NHS, yet they fail to acknowledge their own complicity in austerity. Labour's Westminster front bench have already signalled their intent to stick with Tory spending plans, starving our public services of much-needed funding. And now here in Scotland, they stand before us pretending they have all the answers. Presiding Officer, before they were in government, the Labour Party actually said, you know, the West Streeting actually said that all roads lead to Westminster. The NHS is in crisis, and all decisions that are taken in Westminster don't just affect England, but Wales and Scotland. He also mentioned that this has suffered over a 14-year period when the Tories were there. But when they get into government, that seems to be changed. Like many things, things change. But this SNP government has been funding our NHS, and it's more than doubled. They are investing in more than £21 billion in health and social care in 2025-26, ensuring that Scotland's health service remains the best resourced in the UK. Staffing levels are at a record high, with over 31,300 additional doctors, nurses and other professionals since 2006. That is a 24.6% increase. And crucially, Scotland remains the only part of the UK to have successfully averted NHS strikes. Yeah. Unlike in Labour-run Wales, where junior doctors were forced into the picket lines, here in Scotland we delivered a record pay deal, making our junior doctors the best paid in the UK. That stability has protected patients from the chaos we've seen down south, where over 1.5 million appointments have been cancelled due to the strike action in NHS England. Yet Labour want to lecture us about workforce planning. We already have a national health and social care workforce strategy, and just last November we announced an additional 153 training posts for junior doctors, bringing the total extra training places since 2014 to 880. This government has also increased nursing student numbers every year for the past decade. The Scottish Government are taking a comprehensive approach to ensure that workforce shortages are addressed, both in short and in the long term. Presiding Officer, Labour's motion is not just misleading, it's complete hypocrisy. Let's take a look at the Tory amendment, which is even worse. The party that gave us Brexit, they don't give you nothing, Presiding Officer, you get nothing from the Tories. The party that gave us Brexit, that slashed migration routes for health and care workers, now wants to talk about workforce shortages. The Home Office immigration policies have been catastrophic. An 83% drop in health and care workers' visa application last year alone. And this is not an accident. This is a deliberate choice by the Tories, and it's having a devastating effect in Scotland's social care sector. But unlike the Conservatives, we recognise the importance of international recruitment, but we also recognise the need to support our homegrown workforce. And that is why, in this budget, the Scottish Government are delivering the minimum pay for adult social care workers and the third priority private and independent sectors. That's a 5% increase on top of a 10.1% uplift in 2024-25. This is real action to make social care a more attractive and sustainable career. And speaking of funding, let's not forget the Labour UK government's catastrophic national insurance hike, a tax raid in Scotland's public services which will cost our social care sector more than £84 million. The CEO of Scottish Care has described it as the straw that breaks the camel's back. Labour's choices in Westminster will rip resources out of frontline services here in Scotland, yet they have the audacity to come here today and tell us they are the party of the NHS. And, Presiding Officer, the Tories are calling for the resignation of Neil Gray. Presiding Officer, let's be honest, this is nothing more than political grandstanding from a party that has utterly failed on health policy. Neil Gray has been working tirelessly to improve our NHS and social care, investing billions to support. In closing, Presiding Officer, the people of Scotland want to hear more. They want to see what we've got to do, and the Scottish Government has that.
Thank you very much. Thank you. We now move to closing speeches. I would advise members there's about 10 or 20 seconds in hand, time-wise, which obviously is not very much. And I call on Gillian Mackay to close on behalf of the Scottish Greens. Up to 6 minutes, please.
Thanks, Deputy Presiding Officer. Many colleagues across the Chamber have made robust contributions to today's debate. And this discussion has made clear that while there is widespread recognition of the dedication and resilience of our health and social care workforce, there's also deep concern about the challenges they continue to face. Many Labour members have mentioned a lack of workforce planning, and I think that is a fair challenge to government. However, I think we need multiple workforce plans that not only address variety and gaps across specialties, across some hospitals within the same health boards, but across the country too. I think we need a different GP workforce plan in the Highlands than for the Central Belt. And if some hospitals are struggling for particular specialties, we need to investigate why. We can't pretend that we've solved all of the poor culture in different bits of the NHS, and it is something we cannot take our eye off of. Presiding Officer, I think one of the most important things we can do to help NHS workers is give them the tools to be able to work more efficiently and to deliver care in the most accessible place. For example, wait times for treatment in secondary care are far too long. Some people could be helped to stay well for longer before invasive treatment is needed if they were managed in the community properly. But this involves more money going to primary care to both increase the overall GP headcount, but also to be able to diversify the multidisciplinary team. Utilising technology has to be part of that offer in primary care. It's also well beyond the time where we should be seeing electronic prescribing being used across the NHS. The fact we have GPs signing prescriptions for hours is not a good use of time, and I assume, and I'm sure Dr Gulhani will correct me if I'm wrong, it's not a task that GPs enjoy either. But I think we can also take some burden off of GPs by utilising Pharmacy First to its fullest extent. I was grateful, as I'm sure others were, earlier in the month to have time to speak to the Royal Pharmaceutical Society about how they would like to see Pharmacy First progress. All new pharmacists that graduate being prescribers is fantastic, but at the moment there's too much risk for pharmacists to be able to fully realise the ambitions of Pharmacy First. I had first-hand experience of this a few weeks ago. Because of being horrendously travel sick and being able to take normal travel sickness tablets, I needed some anti-nausea medicine. However, because the pharmacist can't see my notes, and particularly my maternity notes, they didn't feel they could recommend anything, let alone prescribe it, meaning I had to take up a 15-minute appointment with my GP. I'd be really grateful if the Cabinet Secretary or others could look into whether they're willing to ensure that pharmacists have enough information to be able to prescribe with confidence and provide that further avenue for quick and effective treatment. I'll take the intervention from the Cabinet Secretary, please.
Cabinet Secretary.
Thank you. I recognise the situation that Gillian Mackay references and the fact that we are seeking to provide more information. The emergency care summary that was provided through COVID has been standardised and formalised through from October 23. But there is more work for us to do there, and so I'd be more than happy to sit down with Gillian Mackay and with the Chief Pharmacist Officer in order to look at what more we can do there, because I recognise that is an area that we can improve upon.
Gillian Mackay.
I thank the Cabinet Secretary for that, and I look forward to meeting him on that point. I also welcome the development of an app for the NHS. We could save so much time in outpatient clinics by ensuring that an app can add in remote monitoring of patients. Again, I had the pleasure of meeting Kidney Research UK, who lauded the use of the NHS app in other parts of the UK to be able to remotely monitor those with kidney conditions and only ask those to come to the hospital if there's something of concern. This works by allowing patients to put kidney values into the app, which the consultant then reviews and takes action if necessary. The freedom for those patients in managing their own conditions is immense, less trips to the hospital, so less time out of work, school or daily life. For consultants, this means that there's less of a need for constant outpatient review appointments for people that are otherwise managing a condition well, allowing urgent appointments to be free to see those with concerning symptoms or concerns. And that's only one example of where an app would be revolutionary. I wanted to briefly touch on mental health for children and young people, and another way I hope that government may look into supporting good mental health. I visited Larbert High School earlier this session to chat about the work that school nurses are doing across Falkirk in supporting young people. Not only were they helping to navigate exam stress and relationship issues, but for those having a period of poor mental health, they were offering support where a CAMHS referral either wasn't appropriate or hadn't yet happened. The nurses were trusted by the young people and for some were the preferred first line of contact with health services. But in many areas, the numbers of school nurses are declining when I think they can help to support health and wellbeing in schools and provide support and guidance to staff and pupils alike. Staff in the NHS have to be a priority. We've all made pledges and commitments during the pandemic to make the working lives of nurses and other clinical staff better. Some work has been done, but at the moment there has never been a more critical time to do so much more. Some of that is ensuring there are enough staff so that burnout is not the reality, but it's also about the conditions in hospitals to ensure it supports their needs. Multiple colleagues have raised the issue of waiting times. No one should have to wait the length of times that we're hearing about in the chamber today. However, I can't imagine being a staff member in some of these health boards listening to this debate. Every clinician I know does want to see people as quickly as possible, and it's the structure that is failing, not our hard-working clinicians, which is why I strongly believe reform of services is as important as workforce planning. While I appreciate the strength of feeling behind the Labour motion, I do worry that bringing a 10-year workforce strategy forward before summer recess might not balance the need for a workforce plan with reform and those nuances of regional disparity. But the sentiment behind it of urgent workforce planning and work to support staff are absolutely not lost on me. However, I would encourage Labour members, as I did yesterday, to speak to their colleagues at Westminster. One of the biggest pressures Labour members could remove from public services is fully funding those national insurance contributions. I also hope that they would break with what we've seen from Wes Streeting on his increased cosiness with the private sector. I'd like to see us reduce our reliance on the private sector here in Scotland, particularly
Ms Mackay, you will need to close.
Which is costing us huge amounts of money. We need to do more on workforce planning, presiding officer, to make sure that we're not exacerbating an already...
Ms Mackay, you do need to close.
Thank you.
Thank you, Ms Mackay. We have no time in hand. I call on Brian Whittle to close on behalf of the Scottish Conservatives. Up to 6 minutes, please.
Thank you, Deputy Presiding Officer. And I'll start by declaring an interest in that I have a daughter who's a medic in the Scottish NHS. Now, I rise to close this debate on behalf of the Conservative Party, and I thank the Labour Party for securing time in this chamber to debate what is, in my opinion, the most important issue that faces Scotland, the health of the nation. Health speaks to productivity, it speaks to economic inactivity due to ill health, which apparently is the highest in Scotland compared to the rest of the United Kingdom. It speaks to a declining life expectancy, as well as an extremely low healthy life expectancy in Scotland. This debate has highlighted all that is wrong with the SNP approach to health. Jackie Baillie opened this debate, which I thought was a very powerful line, that healthcare professionals are firefighting in a broken system. How true is that? Tim Eagle talked about the normality that is now about corridor care. The Public Health Scotland have highlighted that 1 in 6 Scots are now on a waiting list. Sandesh Gulhani talked about delayed discharge being at record levels, despite the SNP promise not that long ago to eradicate delayed discharge. But, Presiding Officer, if you take 20% of the step-down, step-up beds out of care homes, how can we be surprised that on the other end of that equation, people can't find a place in communities to tackle delayed discharge? And I would remind the Chamber that to keep somebody and look after somebody in what the most appropriate place for them to be in a care home costs £900 a week. to keep them in a hospital bed. It's £1,900 a week. It doesn't even make financial sense. Then we had Douglas Ross in what I thought was a very, very powerful speech, starkly highlighting real cases for real constituents. And I think sometimes we forget in these debates when we're doing this political back and forward that there are real people are being affected. Now, some of us in here sat 7 years ago when the then Cabinet Secretary for Health, Jean Freeman, announced that she was going to introduce 800 extra GP places within the next 10 years, despite the fact that the shortage was 864. One of the things she didn't take into account, of course, was that some of those doctors would be retiring during that time. Wind us forward to now, 7 years later into that 10-year period, and there are less full-time equivalent GPs than there was then. And I say that because I listened to Bob Doris and Neil Gray and George Adam extol how they were training all these new GPs. Results, people, results, presiding officer. There are less full-time equivalent GPs than there were 7 years ago when that was introduced. The First Minister spoke of preventing ill health is also about, and I quote, doing all we can to live healthier lives. And given that the healthy life expectancy of those in the most deprived areas in Scotland is 46 years for men and 47 for women, I have to say I wholeheartedly agree with what the First Minister had to say there. But, Presiding Officer, we are the unhealthiest nation in Europe. Still, and I've been saying that since I came in here and the dial hasn't moved, a healthy life expectancy of 46 is an absolute disgrace in a modern, wealthy country like Scotland. We have a health service dedicated to the treatment of ill health, all the while decisions made by this Scottish Government have made health in other portfolios are reducing Scotland's ability to prevent ill health, heaping ever more pressure on NHS staff. Now, I wanted to use an example here. I know that mental health has been spoken about many times in the Chamber, so I thought I would use that. So if we take the crisis that is mental health in Scotland, we have SAMH extolling the virtues of physical activity in the prevention and treatment of mental health, remembering that they sponsor Jog Scotland. We have Mental Health Foundation, who published a report called Food for Thought, highlighting the importance of diet and good mental health. Then look at the outcomes of Scottish Government policy. Cutting council budgets year after year, meaning that they have to close activity facilities, shut school facilities at the end of the school day, reduce the investment in free school meals, as well as cutting funding to hugely important community mental health projects. Now, that may save the council budget, but it just increases the pressure on the health budget, inevitably with less and less outlets for those suffering mental health issues, especially those who initially have low levels who could be prevented from developing more acute mental health problems. The GP surgery and A&E become the catch-all for all those in desperate need, and the pressure mounts on healthcare professionals. Do you think maybe that SAMH and the Mental Health Foundation are onto something here? And I've been telling this story since I entered this place, and I've discussed it with many health secretaries, and all of them tend to agree, yet the issues are far worse than they have ever been. Decisions in all portfolios affect others, especially in health. In a briefing today, for today's debate, I was interested to read, and I quote, "Today, general practice in Scotland is in crisis, with a shrinking GP workforce, rising patient demand and practices and IT infrastructure that is not fit for purpose." Now, I wish I had time to go into that in much more detail, but a proper IT system would allow integrated, effective workforce planning, swift access to effective local health care, a better working environment for NHS staff and greater opportunities to prevent illness and not just treat it, and free up the precious time for healthcare professionals to deliver on the front line. What we need, Presiding Officer, is a health service that allows healthcare professionals to focus on treatment times and prevention in an environment that encourages retention of staff. And there I shall leave it, Presiding Officer. Thank you.
Thank you. And I call on Marie Todd, up to 6 minutes, Minister.
Thank you, Presiding Officer, and thank you to all the members who've contributed during this debate. It is clear that while there are some differences of opinion, there's a great deal of cross-party consensus and acknowledgement that we should do everything that we can to make the necessary changes that improve the experiences that people have of our health and care system, not least for those who work within it. Our workforce is at the heart of delivering health and social care services to the people of Scotland. Over 400,000 skilled and compassionate people work in many different roles and settings in an integrated way. As the largest workforce in Scotland, they reach into every aspect of life and into every community in Scotland. Social care makes a difference to people every day. It makes a difference to the people who are accessing care, enabling them to lead fulfilling lives. It makes a difference to their families and to their communities too. A thriving, fit-for-purpose social care system will also underpin and enhance a thriving, fit-for-purpose National Health Service. To achieve this, however, we need to change the way that these systems operate. We need to shift the balance of care, we need to create capacity, and we need to build the conditions for innovation. The First Minister has now set out how we intend to achieve that, supported by an ambitious Scottish budget. Of course, this is only possible when supported by a skilled and engaged workforce, a workforce who are in turn enabled by structures and technology which reflect the person-led integrated approach that people want and that we're committed to delivering. I note the calls made for a 10-year workforce plan for our health and social care system. What's needed is a dynamic, integrated approach to workforce planning that strongly links strategic reform and direction, financial plans and a precise understanding of where we need skills and capability, whether that is provided through people or through technology and AI. As the Cabinet Secretary outlined in his remarks earlier this afternoon, we're committed to publishing our medium-term approach to health and social care renewal before the summer recess, describing how we will deliver services across our population in the future. Our proposals will be underpinned by the approach to workforce planning, which I've just described. The Cabinet Secretary briefly touched on our plans in relation to social care and in particular the National Care Service. As I outlined in my statement to Parliament last week and letters to stakeholders, I've worked to find a way to deliver on our commitment for a National Care Service that delivers much needed change without the need to legislate for structural reform. And far from slowing down the chance to deliver reform, I'm determined to take this opportunity to move rapidly. Whilst Labour and the Conservatives may be happy to simply point out the problems, this government is focused on the solutions. And we will continue to deliver the changes our workforce so desperately needs. I'm happy to give way.
Finlay Carson.
I appreciate the Minister giving way. I've no doubt the two ministers on the front bench and the Cabinet Secretary want to do the right thing. But we've seen visits to Dumfries and Galloway. The Minister visited there ourselves and gave assurances that healthcare was going to be patient-centred, but did nothing to protect maternity services in Stranraer. We heard about the problems around our cottage hospitals and delivering care as close as home to possible. You said all the right things, but when we get responses from written responses, they don't bear any resemblance to the words that you speak, or I beg your pardon, the Minister speaks, or our colleagues, when it's speaking to constituents. So why can't we get a joined-up approach and be honest about what you can and can't deliver? Because the constituents, particularly in Dumfries and Galloway, don't want to hear Emma Harper telling us exactly how much money has been spent on a service. We want to see these services improved, and we want to see equality, particularly in rural areas.
Minister.
So the member will recognise that within the ministerial team there's a great deal of rural experience, and we're absolutely committed to ensuring that our rural constituents and the rural citizens of Scotland can access high-quality health and social care. I have no doubt that we will continue to engage with the member and with Emma Harper, who has pursued these issues with absolute diligence. I will move quickly to establish a National Care Service Advisory Board. They are going to help to advise, to scrutinise and to drive improvements in the sector, not only for those accessing services but for those delivering it. And we continue to push forward on our Fair Work agenda, ensuring that our workforce in social care are fairly paid, heard and supported in their roles. The draft budget for 25-26 sets out almost £2.2 billion investment in social care care and integration, of which an estimated £950 million enables adult social care workers in the third and private sectors to be paid at least the real living wage. I'm very proud of that progress, that commitment in Scotland that we have to our social care staff. That means our social care staff in Scotland are paid at least £1,000 more than their equivalents in England. And, of course, because of this government's commitment to progressive taxation, they pay less tax in Scotland as well. We must continue to improve pay terms and conditions for the social care workforce. We're working closely with partners to develop a sectoral bargaining approach that works for the social care sector, and we're also working with the UK Government on the Employment Rights Bill, ensuring it works for Scotland and complements the progress that we have already made. I'm afraid I am running very short of time to pick up on all of the points that the members have made, but I assure you that this ministerial team is listening carefully and will respond to the challenges within the system, within the health and social care system in Scotland, and rise to those challenges that we are facing today.
Thank you. And I call on Paul Sweeney to wind up the debate. Up to 7 minutes, please.
Thank you, Presiding Officer. I rise to second and commend to Parliament the motion in the name of my friend, the member for Dumbarton. And it's a very important motion indeed, because the National Health Service in Scotland accounts for a third of all public expenditure that the Scottish Government is responsible for, and indeed up to half of day-to-day public expenditure. Though over the course of the current Government's administration of our National Health Service over nearly 18 years, which is actually a quarter, or just approaching a quarter, of the NHS's entire existence. So this Government has had almost the largest span of control of our national healthcare system since it was first set up 76 years ago. In that time, the spend in Scotland per head relative to the rest of the UK was 17% more at the start of this Government's tenure. It is now just 3% more. So a significant decline, clearly, is a priority overall in public expenditure for this Government. And we have seen the consequences of that long decline in relative importance to the Government as its overall pattern of expenditure has evolved. We have seen this come forward from clinicians, we've seen it come forward from our constituents in correspondence, and that is why we are here to convey these arguments to you today. We are representing their interests. And like many members have said, ministers and backbenchers alike, that we are all here to back our NHS workforce. We're here to back our constituents who are seeking to access healthcare free at the point of need, and to remove, of course, as the purpose of the NHS was when it was founded, to remove money worries in times of illness. And unfortunately, as we've heard all too often today from members across the chamber, that when people are in need, the NHS simply isn't there for them. And also they are waiting so long that they are developing money worries because they are facing the torment of pain or having to pour out their life savings in many cases to fund their medical treatment. I think that was put ably by my colleague in Glasgow, Paula McNeill, who was talking about her constituents who have been forced, because they're waiting so long, often for elective treatments, to actually pay to go private, some of them remortgaging their homes or dipping into their pension savings to do so, when they should be gearing up for a settled retirement. Yes, happy to give way to my colleague.
On that point, thank you, and I support the contribution that the member is making. Would the member agree with me then that it's also really concerning that I have constituents who have paid privately in excess of £700 just to get assessments and diagnosis for their children and young people so that they can finally access the support and care that they need?
I think it's a key point that my colleague Ms Duncan Glancy makes, that we've heard it all across Scotland. We've heard it. Surely every member here has received correspondence from constituents in these sorts of problems, where people can't get access to the healthcare system through the front door. When they get into the healthcare system, they're not getting speedy referral to where they need to be within the system, and then they're not being treated quickly enough. And then when they are treated, and often in a state of infirmity, they can't get out of the system to an appropriate destination fast enough. And those inefficiencies are at the heart of what's going wrong here. The flow through the system is not optimised, and none of us should be satisfied with this situation. And indeed, some of the propagandistic speeches we heard from some of the government backbenches today do an ill service to constituents who they represent. And I think constituents who are listening to some of those bombastic claims will be bewildered by the arrogance. And actually what they want to see is, even if the healthcare system in Scotland were the best in the world, we should not be satisfied with that, because in any human system there's always scope for improvement.
Mr Sweeney,
business...
if I might just stop you, I'm just conscious of various conversations that are carrying on across the chamber. Grateful if we could treat our colleagues with respect. Paul Sweeney.
And our business here as parliamentarians is to make sure it is always improving, is always getting better, and we are conveying ideas on behalf of our constituents in order to achieve that. And certainly there have been many good observations. For example, my colleague Rhoda Grant, representing the Highlands, highlighted the urban bias often in healthcare planning. And I think that was reiterated by several members, most notably by Mr Ross, who also represents that more rural part of Scotland, highlighting some of the appalling waiting times that constituents are having to face. And indeed, when one looks at the analysis by the Institute for Fiscal Studies, for example, on 6 key metrics of the healthcare system in Scotland, elective care and the size of that waiting list is worse than last year and worse than prior to the pandemic. Elective care and percentage of treatment within 18 weeks from referral, worse than last year. But actually in the rest of the UK these metrics are getting better. Emergency care 4-hour waiting times A&E, worse than last year. Cancer care, waiting more than 62 days between referral and treatment. I will take in a moment. Waiting more than 62 days between referral and treatment. As we've heard from oncologists, that is the equivalent of a death sentence in many cases, if people are waiting that length of time between diagnosis and treatment for cancer. Worse in Scotland than last year, but getting better in the rest of the UK. That is not something that this government can be satisfied with. In fact, it's appalling that they could be so complacent when people are dying, their constituents are dying because of this lack of performance, and their clinicians, their colleagues in the NHS, are at their wits' end with the frustrations they sense and been unable to get the system to perform better. I'll give way to the lady.
Christine Graham.
I have a lot of time for the member, but does the member agree with me that we've got rid of prescription charges in Scotland? Do you think Labour in the UK should get rid of them there when it's nearly £10 an item?
Paul Sweeney.
Well, I think I'm not unsympathetic to our point about getting rid of prescription charges, but I would note that prior to the SNP getting rid of 100% of prescription charges, there were already around 90-odd+% of prescription charges free in Scotland anyway. So by moving it from 95% to 100%, it's a very marginal change, but it got a good headline. So I think it would be a degree of sophistry on the part of the member. I think of sophistry on the part of the member to suggest that everyone was paying for prescriptions before the SNP came into power. And I would highlight actually that it's a particular example of the lack of sincerity we're trying to deal with when we're talking about the evidence-based approach we need for our healthcare system. And that's why so many members have came here with appalling stories about what we need to do to improve the system and how we can deliver that. It's absolutely outrageous that we have 863,000 waiting list places in Scotland. We should be moving that forward at a far greater degree. And until the Minister can deliver that, when we're having clinicians tell us that operating theatres are lying empty and not being fully utilised because anaesthetists aren't in the right place to actually perform operations along with surgeons, we need to get these things correct. We need to listen to what the workforce are telling us. We need to plan that workforce properly. We need to reduce the appalling outflow of expenditure on temporary agency contracts, on locums, and indeed forcing our citizens to what is an effective privatisation of the healthcare system when we're forcing them to wait so long that they're tormented enough into having to pour out their life savings to access private healthcare. That is, by anyone's measure, privatisation by the back door when the citizens are forced into that situation. So as long as that is persisting in Scotland, we cannot rest. We must come together as a parliament and ensure that we work together collaboratively to find ways to improve that situation for people of this country.
Thank you. That concludes the debate on supporting Scotland's health and social care workforce. It's now time to move on to the next item of business, which is consideration of Business Motion 16265 in the name of Jamie Hepburn on behalf of the Parliamentary Bureau setting out a business programme. And I call on Jamie Hepburn to move the motion.
Move, Presiding Officer.
Thank you, Minister. No member has asked to speak to the motion. Therefore, the question is that motion 16265 be agreed. Are we all agreed? Yes. The motion is therefore agreed. The next item of business is consideration of business motions 16266 on a Stage 1 timetable for a bill and 16267 on a Stage 2 timetable for a bill. And I ask any member who wishes to speak to the motions to press their request to speak button. And I call on the Minister on behalf of the Parliamentary Bureau to move the motions.
Move, Presiding Officer.
Thank you. No member has asked to speak to the motions. Therefore, the question is that motions 16266 and 16267 be agreed. Are we all agreed? Yes. The motions are therefore agreed. And the next item of business is consideration of Parliamentary Bureau motion 16268 on approval of a UKSI. And I ask Jamie Hepburn on behalf of the Parliamentary Bureau to move the motion.
Move, Presiding Officer.
Thank you, Minister. The question on this motion will be put at decision time, and there are 4 questions to be put as a result of today's business. The first question is that Amendment 16252.1 in the name of Neil Gray, which seeks to amend motion 16252 in the name of Jackie Bailey on supporting Scotland's health and social care workforce, be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we'll move to a vote, and there will be a short suspension to allow members to access digital voting.